Welcome to Business Innovators Radio, featuring industry influencers and trendsetters sharing proven strategies to help you build a better life right now.
I'm talking today with Dr. Eugene Elliott, and we're going to be talking about there's a lot of powerful signs that most people would love to look younger. And before we get into some of the ways that they can do that, what led you into this field?
Well, I have a bit of a esoteric and interesting background. I was in undergraduate education. I was an art and literature major. So the art background kind of led me with I had a facility with three-dimensional work. And as I went through medical school, it became pretty clear to me that I could use that art background in plastic surgery much more creatively than I could use it in other medical specialties. So I gravitated that way, and it worked out very well. And I think the art background also gives me a little bit of an edge in terms of aesthetic judgment. We see a lot of what I would call overdone or unaesthetic aesthetic outcomes, plastic surgery outcomes out there. And I think part of the reason is that sometimes the eye of the surgeon is not sensitive enough to the structure, bony structure, etc., body structure. So that's a long-winded answer as to how I kind of got into this specialty.
Well, no, I really appreciate that, because that's an interesting dichotomy that I wouldn't have thought about before, that a surgeon may be looking at it through the eyes of a surgeon and not through the eyes of a fellow human, for lack of a better word, who's really looking at the perspective your art background gave you.
Yeah, so if you think about plastic surgery, it's a bit of a form of sculpture, if you will, with limitation. Unfortunately, the body, you can't sculpt the body like you can sculpt a piece of wood or a block of granite, but I think it helps to have a bit of that three-dimensional sculptor's eye when you're working.
Yeah, I could see that. That's terrific. What are some of the ways that people can look more youthful?
Well, we usually start with patients come to the office, and you're absolutely right. Patients do come and they want to look rested and more youthful, and they use those terms. We start with the skin, and in Southern California, we see patients who have sun-damaged skin. When they were younger, they were unprotected, and as they age, you see the ravages of unprotected sun exposure in the form of pigmentation in the skin and the face, deep wrinkles. So the canvas, the skin, is addressed first, and there are many ways we can improve the skin surface. Sometimes we use chemical peels. Sometimes, very unaggressively, we use some medicated creams that can bleach the skin a little bit, and just getting off a little pigmentation can make a patient look a little younger. Getting more aggressive peels, we use what's called laser resurfacing, to tighten up the skin a little bit and reduce wrinkling. So those type of modalities are a wonderful adjunct. But we always start with the skin. You can do other things. You can go straight to a facelift or eyelid surgery or whatever if indicated. But if you haven't addressed the skin, the surface still looks old. So you have to look at everything.
If our audience could have seen me while you were describing that, they would have seen me cringing and rubbing the edges of my eyes, because I'm a very fair-skinned person. And in the early 80s, I would go to the beach. I went to school in San Diego, and sunscreen was not a very popular thing to use back then.
Absolutely.
People were using baby oil because they wanted that dark tan look, etc. But my skin really has all of those ravages that you're talking about. I would be out in the sun and I would be squinting, and I'm probably a candidate for your services. But obviously, I may have answered this next question, but how would people determine if cosmetic surgery was right for them?
Well, I think it starts with an honest discussion with the patient. So what I mean by an honest discussion, patient in the course of a consultation has to understand what the limit is. And, we don't have a magic wand, but certainly with the modalities that we have available, we can improve. So if a patient's realistic and they understand and the surgeon is honest, and ethical. At the end of that consultation, the patient will understand, okay, I can look a little freshened. I can reduce my wrinkles a little bit. I can reduce the pigmentation a little bit. And if I'm having any surgical procedures, I can look more rested. I can have less skin hang over my eyes, or the bags under my eyes improved, or my neck contour improved, and my jowls improves. So when a patient understands what can occur and what to expect and what can't occur, in other words, you can't turn the clock back 30 years on most patients, but if you use terminology, you'll look more rested. You'll look a little more youthful. And indeed, some patients, they start off looking like their mother, and then when you're done with them, the before picture looks like their mother. So I think it's a thorough understanding of, first and foremost, the limitations of surgery. And if they're comfortable with that, they proceed.
So it sounds like being an educator and an advocate
so important
for people is really critical.
It's very, very important. And the converse is important as well. If you aren't an educator and you aren't honest as far as expectations are concerned, both you and the patient are going to be in trouble after surgery or after a procedure because you're going to have dissatisfaction. On the backside, that's not pleasant.
What would you say to people who are concerned about major surgery and recovery time?
Well, I don't downplay any surgical procedure. I think any surgery is major. And first and foremost, safety is extremely important. And safety starts with, first of all, an assessment of the patient's general health. Are they a good candidate for elective surgery? Some patients aren't. Some patients have high blood pressure, not controlled. Some patients have diabetes, not well controlled, other disease processes which don't make them a good candidate for elective cosmetic surgery. So you have to get through the medical history, and a lot of the time I will ask for what we call medical clearance. So we'll go back to their regular physician if they have one, who knows their general health best, and assess whether they're okay for elective surgery. And then if they get through that process, that's kind of initial rudimentary screening, we get lab work. We make sure currently the lab work shows that they're healthy. And then you get into the procedure itself. Where do you do it? And how do you do it? Are you doing the surgery in an office operatory? Are you doing the surgery in a accredited surgery center? Are you using a nurse anesthetist versus a board-certified anesthesiologist? So there are different levels of safety in terms of performing an elective cosmetic procedure. And my philosophy is you've got to be as safe as you can. It might be a little more expensive for the patient. So when I take my patients to an outpatient surgery center that's accredited, that has board-certified anesthesiologists that I know that I would let put my family to sleep, they're going to pay a little more than a surgeon that does it in their office and uses a nurse anesthetist. Because corners can be cut a little bit in cost, but for me, safety is of utmost importance. And when patients understand that concept, you get very little pushback because, quite frankly, they want to wake up at the end of the procedure. That's a reasonable goal.
What are their expectations, or how do you handle the recovery time and managing expectations there?
Well, again, it takes a lot of honesty. Some surgeons are pressed to book a lot of surgery, and patients kind of learn about recovery on the back end, which is not a good idea. So it requires adequate time spent with the patient based on their profession, on the demands of their work, an honest appraisal as to when the surgeon feels that the patient can get back to work. So there's a difference. Today I saw one patient, sedentary. She works at a desk. She's in front of a computer all day. She doesn't lift heavy objects. So she can get back to work more quickly than a patient who I saw later in the day who was traveling salesperson, in and out of her car all day, driving over 150 miles a day, lifting heavy objects from her car. So every profession has some limitations in terms of when a patient can get back and perform those activities. But in general, I give a very detailed description of what you can do in your recovery and at what point in your recovery. When can you travel? When can you go in public? When will you look reasonable to go in public and interface with the public? When can you go back to exercise if you exercise? And most patients, when they understand the limitations, they're okay with it. They're motivated to get the results, so they understand that requires a certain amount of recovery and restriction, like any surgical procedure.
As I'm hearing you describe the educational component of this and managing expectations, it would seem there's a real ongoing theme of, hey, it's great if patients are lucky enough to have a doctor who is going to manage those expectations and educate them on the things they need to consider before they take a step like this. But they really patients need to take it upon themselves to take some responsibility in the process, because
Absolutely.
If they don't, and they are faced with a doctor who, as you alluded to a moment ago, is they're in the surgery business more than they are in the people business. It's almost a let the buyer beware, for lack of a better term. So it really is important that the patients need to go through their checklist, so they're looking after their own best interests, and hopefully they'll find somebody that's taking the steps that you've outlined.
That's well stated.
Who's having cosmetic surgery?
It's interesting that the demographic is very broad. We see younger patients commonly come in for breast enhancement, is a very common procedure. Younger patients coming in for liposuction and some body contouring. By the way, when I see a patient for liposuction, my first response is, you should be in the best physical condition you can be. And if this is an issue of weight loss, I'd like you to get on a program of weight loss before you even consider surgery. So do the best you can for yourself. Get on a good diet, have an appropriate lifestyle, and don't use surgery as a quick fix. So it's that demographic. Middle-aged patients, both men and women, they feel that they're losing a little bit of competitive edge because they're starting to look a little tired, a little worn out, so they want to regain a bit of that self-confidence and competitive edge. So we're seeing that middle-aged population with facial surgery, eyelid surgery, facelift surgery. Always in that middle-aged group we're doing, and younger patients now, we're doing conservative Botox and fillers. Those are conservative measures in the office that help offset the ravages of time as well. And then you see the patient who is, early, mid-60s. They're really starting to look back at their photographs of 20 years ago, and a lot of their friends have gone through similar procedures successfully, and they want to set back the clock a little bit. They're still healthy. They feel that they're still in that window of opportunity where their health would still allow them to undergo elective cosmetic surgery successfully.
There's so much of what you're saying that must resonate with our audience. It's resonating with me on so many levels. I really appreciate when you're using the term tired, because I'll never forget my wife at the time came home and said, a colleague of hers said she looked tired. It was almost the worst thing that person could have said to her. She found it very insulting, and she really considered what her options were after that. She did not like the way that sounded. And everything you're saying, it's resonating with me. These are all thoughts that I've had, and I think most folks have one way or the other, just when you look at a photo and say, my goodness, is that the same person?
Exactly, and I get that response quite often. The initial trigger is, I was just at a family gathering and I saw those photographs and, oh my God, do I really look like that? That very commonly is a trigger. What's most important, though, is that the trigger is not an external trigger coming, let's say, from a significant other. It's psychologically, at the end of the day, it's important that the patient, that they want the change for someone else. That psychological component is extremely important.
There's just so much value in every point that we've discussed so far. What are some of the biggest misconceptions people have about cosmetic surgery?
I think some of the TV shows we've had over the years have created some misconceptions that it's a total walk in the park, that there isn't really any recovery time, that they're going to have surgery and the next day or two they're going to look fabulous and they won't have swelling, bruising, and they can go out dancing. We see that response, and they just have to be grounded, and understand that a lot of those TV programs aren't really reality. And then you get misconception. There was that program years ago, not that many years ago, of the extreme makeover. And some patients come in and they have this conception that they can do many procedures at once, irregardless of safety, because they don't understand that as you start accumulating surgical procedures one on top of another and accumulating anesthetic time, that you're increasing your risk as well. So we get those type of misconceptions. Patients, they have to understand very clearly what the limitations are in their own anatomy that will not allow the surgeon to accomplish what they want. An example would be a patient for breast surgery. They may want breast enhancement, and their friend had breast enhancement, and they've seen their friend, and they feel that they would like to be the same size as their friend, but their particular anatomy would not allow that. So they have to be grounded and educated as to what their particular limitations are, what their anatomy will allow. It's all about education.
It also gets back to this theme of the patients need to have a tremendous amount of responsibility in the process, because if they don't, there's going to be plenty of people out there that will just say yes to whatever they want, and that yes may be taking them down the wrong path.
Absolutely. Be a very slippery slope.
Everything we've been discussing here has really resonated with me personally. We'll set the appointment after our interview here. How could somebody like myself now that's considering cosmetic surgery find out more about Dr. Eugene Elliott and how you could help them?
I think in general, when a patient is looking for a plastic surgeon, I think the point should be to find a board-certified plastic surgeon. So what does that mean? That sounds simple, but it's very confusing, because there's only one board for plastic surgeons, real plastic surgeons, and it's called the American Board of Plastic and Reconstructive Surgery. And if the surgeon is board certified, it at least assures the patient that they've gone through appropriate and proper training, have taken the exams, both oral and written, which are quite difficult, similar to a bar exam for an attorney, and have the proper credentials. The confusion lies in the board certification, because there are other specialties, other physicians that call themselves plastic surgeons, but they're not certified by the American Board of Plastic and Reconstructive Surgery. Now, there is slight overlap. You have what are called oculoplastic surgeons, who may be ophthalmologists, who are trained in plastic surgery procedures around the eye. And they're very well trained, if legitimately trained. And then you have overlap with ear, nose, and throat surgeons, and here's where it gets a little confusing. They have their own board, but it's not a truly recognized board. And some ear, nose, and throat surgeons, although they're qualified and trained to perform plastic surgery from the neck up, they stray down below the neck and still claim legitimacy. So patients really have to do their homework. But they start there. That's a good starting point. And then getting a referral, certainly a happy patient, a successful outcome is a superb referral. My practice base is I do no advertising in my practice. It's all based upon taking care of a patient, one patient at a time, making that patient happy. That's going to tell another patient about their experience. And then in the community, physicians know, nurses know. They see you operate. They may not see the outcome, but they hear about the outcomes. So there's several ways to get to a plastic surgeon. At the end of the day, it's chemistry. It's feeling comfortable with that particular surgeon. It's feeling comfortable that surgeon spent enough time with them, explained everything well enough. I teach the residents at UCI. And I gave a lecture to the residents last night. And I told them that it's a quantum leap for a patient to come into your office in 2 separate sessions. You may spend 2 hours with them in consultation. The staff may spend another 30 to 45 minutes with them, educating them. So say after 3 hours, they have the confidence to lie down, be put to sleep, and let someone operate on them. I've been in practice over 30 years. I still find that amazing.
This has been extremely eye-opening for me. I feel like we've barely touched the surface on so many of these issues. And if there's some major takeaways, it would seem to be, at the very least, do not enter in while cosmetic surgery is a very viable solution to looking more youthful and getting a taste from that mythical fountain of youth, is not something that should be entered into lightly. There are many considerations, and people just need to be aware of that so they can avoid a lot of the risks associated with doing it the wrong way with the wrong people.
Absolutely. And the reality is there are risks to any surgical procedure. Of course, there's risks to crossing the street, but you can minimize those risks and mitigate risks by doing very, very careful work and very, very careful preparation.
How could somebody reach you if they were considering cosmetic surgery?
Well, directly from me, they would just call my office. It's 714-241-0646.
Your web address.
The easiest way is just to Google my name. If they Google Eugene Elliott, MD, they'll see my website, or they can go directly to DrEugeneElliott.com.
You really opened my eyes. I feel like there's a lot more to address with this issue, but I think that our audience would be well served by reading or hearing about this interview. This is absolutely fantastic, and I really appreciate you sharing your valuable insight with our audience.
Oh, it's been my pleasure.
Well,
I'd always be happy to give you more time. It would be my pleasure.
Could provide a photograph or two that may show you a patient, you with a patient, or somebody who's reaping the lifestyle benefits. And, well, you know what might serve us better is if we could just get a picture of you in the foreground, being outside and healthy, and have
sure.
you. That would be all the better.
Oh, sure.
Yeah. We want to get your name out there and promote this.
We can do that over the weekend.
That would be great.
Okay.
Yeah, and you don't need to do anything crazy. Our mobile devices have wonderful cameras, so just use a mobile device. If you've got another camera that's higher end that you love, that's great. But the majority of folks use their mobile devices, and the pictures just come out great. So,
do you want me to look just casual?
Yeah, casual, healthy, absolutely. Just be natural, be yourself. That's the most important thing. We don't want you to look like somebody who's posing for an ad. We want you to convey that you're there leading the healthy lifestyle and not looking tired. We don't want to look tired.
Well, you're assuming I've had cosmetic surgery now.
No, I do not. And I believe you probably are living a life where you want to look your best. But I have to tell you, my wife, when she came home and said it through clenched teeth that somebody said she looked tired, it was as if somebody asked her when she was due. And she wasn't due.
Wow.
It was one of those. I'll never forget that, but you triggered that memory for me.
Yeah, it's a common lament. Yeah.
Yeah. Oh, gosh, go ahead.
If you can text me or just let me know where and how to send that photograph.
I will. And I don't know that Chris gave me your email address. What would
Let me give that to you.
Yeah.
Sure. Yeah, I'll give you my private email. It's ELIOT, so 1L, 1T, MD at roadrunner.com.
Yes, thank you. Okay, so ELIOTMD 1L1T at roadrunner.com.
Correct.
Yeah, the how do you know you have a real doctor would be its own interview. I think that would, because you started to dig into some really interesting things there that the average person just wasn't going to consider. And as you so eloquently stated, it's not that you're necessarily dealing with somebody who isn't immensely qualified in certain areas, but they're getting outside their core competencies, and that can be very dangerous for you.
Absolutely.
Yeah. So that's great.
Especially in an area like where we live, you see more of that activity when you have a lot of physicians in a small area.
Right.
Yeah.
So,
and they're all competing for the same patient base.
Right. Yeah, interesting. Well, I really appreciate you following up with me. This was great, and I will send you off a packet of goodies here that's got the information I need and a little bit about the photo, and then I'll package up what we've got so you can see that and show that to everybody. So,
my pleasure, Conrad. It was a pleasure spending time with you.
Thanks for listening to Business Innovators Radio. To hear all episodes featuring leading industry influencers and trendsetters, visit us online at businessinnovatorsradio.com today.